Family planning is always important when you plan on having a small family. Here in Nairobi, the women we've talked to have told us that to achieve this, they have involved their husbands all the way, just like this 50-year-old woman.
I have 3 children. The oldest is 30 years. The middle one is 24, and the last one is 16 years.
She used the coil as a family planning method to space her 3 boys. But after her third born, she went for a permanent method, TL, tubal ligation or tubectomy, which is the removal of the woman's fallopian tubes. This means the eggs will no longer reach the uterus to get fertilized by the sperms.
My husband was comfortable, and we felt that one is the best way.
For this couple, their next born could appear after 2 years when Elvis turned 3.5 years. But for now, they are using injector plan. Each injection prevents pregnancy for at least 3 months.
That's the good range. That's how we've planned.
But the onus is always on the woman. For some married men, condoms and vasectomy are not options.
With my wife? No, we don't use.
Vasectomy, that's a death warrant because anything can happen to my children and I'll need more children.
It took 35-year-old Margaret Wangoi here in Kenya 11 years to get her second-born Penina, who she says could be her last child. She says, I used to employ family planning for all those years until Penina, but now I'm done.
There are many reasons why women choose to use contraceptives. They understand that spacing children at least 3 years apart is the healthiest way to ensure that your newborns will grow up well. And they also have ideals of their own.
Talking to Ugandans, there is not much difference except in the number of children one can have.
I have 4, 14, I have 10, I have 8, and I have 6. Use the pills.
This lady explains why she decided to call it quits even when her man wanted more.
After 6 kids, I told him I was tired. He never believed me. I secretly went to the hospital and lied to the doctor that my husband wanted a permanent method. My tubes were tied.
Previous demographic health surveys have put Uganda at 7 children on average for every woman throughout her reproductive life, and this has not changed much since 1988. But since 1993, Kenya's figure has been 5 children per woman or even less.
Contraceptive use is increasing among married women all over East and Southern Africa. The most recent data we have from Kenya is 2008-2009, and about 39% of currently married women are using modern contraceptive methods. The number is much lower in Uganda, but the data we have from Uganda is from 2006.
With a demographic health survey underway, Uganda can only hope that her people have become less reproductive.
Because school fees is becoming a problem, and the countries, the population is becoming big as there is no way I can explain, but it's becoming more and more and more, and the land is not increasing.
This gentleman couldn't have put it in better in summarizing the situation in Uganda, which has an annual population growth rate of 3.2%, one of the highest in the world. This means every year over 1 million babies are born in this country.
There's also a question of the availability of contraceptive methods, and there's a question of political will. Are the governments equally interested in providing family planning services and promoting smaller families? Not all governments are.
Kenya's Daily Nation newspaper last week had a story of an MP encouraging women in his constituency to have more babies for a packet of diapers and 5,000 Kenyan shillings, approximately 130,000 Ugandan shillings, about $50 US. Many poor people may accept this money for the immediate benefits, oblivious of the future implications. But for the MP who openly said so, more people could mean more votes to fulfill his ambition to become president in 2027. President Yoweri Museveni has also advocated for a large population, but for a different reason, the creation of a large market for Uganda's products. But economists say effective demand must be backed by the ability to buy. The question then is, does sheer large numbers necessarily create demand? Florence Nalimba, NTV.